women who come to me with gut problems have already done a lot of work. They've cut gluten, they've tried the elimination protocols, they've added probiotics, and they're still feeling bloated, exhausted, and foggy. These women assume they have to keep removing foods from their diet to find the cause. But the real problem has nothing to do with food. There's a layer of cells lining your digestive tract that controls how well you digest, how clear your thinking is, and how strong your immune system is. When that lining is damaged, no diet in the world fixes it. And there's a breakthrough peptide protocol that most providers aren't talking about yet that targets those cells directly. You probably know of peptides for weight loss, but there's a lot more they can do, and fixing your gut is one of them. In this video, I'm going to show you what's damaging that lining, why food changes won't solve it, and what this peptide protocol actually does that nothing else can. What's actually happening inside the gut wall? Here's what's actually happening in your gut. Your digestive tract is lined with cells, single cell thick in most places. That lining is what stands between what you eat and your bloodstream. It's not a passive wall, it's an active living barrier. And its job is to decide what gets through and what doesn't. When it's healthy, it lets nutrients pass and keeps everything else out. Bacteria, toxins, partially digested food particles, none of that should be crossing into your bloodstream. When it's damaged, the junctions between those cells start to loosen. Things that were never supposed to get through start getting through. Your immune system sees those particles in the bloodstream and reacts to them like invaders. That immune reaction creates inflammation, and that inflammation doesn't stay in the gut. It shows up as bloating, brain fog, fatigue, joint pain, skin flares, and anxiety. Weight that won't move despite doing everything right. This is what most doctors call leaky gut. It's not some fringe theory. It's a clinically observable pattern that I see in patients regularly. The reason diet alone doesn't fix it is simple. A cleaner diet reduces what's irritating the lining, but if the lining itself is damaged, you haven't fixed the barrier. You've just reduced the assault on something that's already broken. You can eat perfectly and still have a gut that's actively leaking inflammation into your body because the food changed, but the wall didn't. Clearing of your diet is like mopping up the floor with a faucet that is still running and a sink that's overflowing. You have to stop the leak at the source in order to not endlessly be mopping up the floor. What's damaging the lining that has nothing to do with food? This isn't the only thing affecting your gut. When we talk about gut health, we almost always frame it as an input problem. What are you eating? What are you avoiding? What are you adding in? But the gut lining doesn't only get damaged by food. There are 4 things I see damaging in my patients consistently across years of practice. They have nothing to do with their diet. The first is chronic stress. Scripture tells us not to worry, to cast out our anxiety, to choose faith over fear. And most of the women I see genuinely believe that. They're not anxious people by identity, they're women of faith. But belief doesn't always change biology. Because the reality of life at this stage is that you're carrying an enormous amount. Work, marriage, kids who still need you even if they're grown, aging parents, finances. The list doesn't stop just because your faith is strong. And the culture we live in has normalized that level of carrying to the point where women don't even feel it as stress anymore. It's just a Tuesday. What's happening in the body, though, is measurable. When cortisol stays elevated for long periods, it directly disrupts the gut lining. It loosens the tight junctions between gut cells. It reduces the protective layer along the gut wall and slows the body's ability to repair it. The women I see in my practice are almost never people who would describe themselves as chronically stressed. They're faithful, they're managing, they say they're fine, but their cortisol tells a completely different story. The problem is their gut has been paying for that invisible load every single day. regardless of what they're eating. The second reason is hormonal decline. Estrogen plays a direct role in maintaining the gut lining. When estrogen drops, as it does in perimenopause, the gut lining loses some of its protective function. That is why so many women notice their gut getting worse in their 40s, even when their diet hasn't changed. It's not a coincidence. The gut lining changed because the hormones that were supporting it changed. The third is common medications, NSAIDs, ibuprofen, naproxen, the things that most of us will reach for. These are well documented gut lining irritants. Antacids, taken long term, alter the gut environment in ways that affect the barrier. These are medications women take regularly, sometimes daily, without anyone connecting them to why their gut isn't healing. The fourth is environmental toxins and the food supply itself. Glyphosate, food grade chemical preservatives, the research on these affect gut integrity is still developing, but the clinical picture I see in my practice is consistent. Women eating very clean diets still have gut presentations that suggest persistent lining damage. The world we live in now is not the world our grandmothers' guts were designed for. When you're dealing with all four of these simultaneously, which many of my patients are, no elimination diet is going to fully repair what's being damaged faster than food changes can rebuild it. You can eliminate every inflammatory food on the list and still have a gut wall that's actively breaking down because the thing damaging it isn't on any food list. The pattern I keep seeing in my practice. Before I tell you what can actually repair the lining, I want to describe a patient profile, not a specific person. I see this pattern so frequently, it belongs to more than one patient. She's somewhere between 42 and 58. She's been intentional about her health for years. She's not someone who eats carelessly. She's tried multiple elimination protocols. She's been to the GI provider. She's been told her scope looks fine, or that she has IBS, or that stress is probably a factor. She's managing the stress, and she's still symptomatic. When she comes in, we look at the full picture, not just her gut, her hormones, her cortisol, her inflammatory markers, her history of medications, her stress load, not the self-reported version, but the clinical version you see in the labs. And almost every time, we find the same thing. The gut symptoms are downstream from something she didn't know to connect to her gut. A hormone picture that shifted years ago, a cortisol pattern that has her nervous system in a state of low-grade alarm she's so used to, she doesn't feel it as stress anymore. Gut lining markers that suggest damage that diet changes alone aren't going to close. The diet work she did made a difference. It reduced the load, but the lining never healed. So I think of a patient I had recently, 38-year-old female, single mom of two young teenagers and working full time. She came in with really a lifelong list of GI symptoms to include bloating, irregular bowel movements, triggers to certain foods that would cause her systemic inflammation and joint pain. She did have a remote diagnosis of Crohn's disease and rheumatoid arthritis. So lots of autoimmune issues. And we, of course, did a workup and looked at her hormone panel, metabolic panel, and gut history. She had an elevated ESR and CRP, which are inflammatory markers. She also showed a dysregulation of her hormones. Being in her late 30s, we already saw shifts in estrogen, progesterone, and a declining testosterone. Her sleep patterns, of course, were horrible. She reported that 3 a.m. every morning she was waking up, and her cortisol levels correlated why she was waking up at the same time every morning. We actually started her on a peptide that we're going to talk about in a minute, and she had significant relief of symptoms within 6 weeks. She was able to get through her day so much more effectively without inflammation, sleeping better, and had reported better joint pain, better overall mood, and less triggers to food and less GI symptoms. Her gut wasn't dysfunctional because of what she was eating, but because of what her body had been carrying for years without anyone looking for it. What can actually repair the lining? So if diet is only half of it, what's the other half? It's repair, not management or reduction. Actual structural repair of the gut lining itself. And this is where I want to talk about something I use in my practice that most practitioners aren't reaching for yet. It's called BPC 157, Body Protection Compound. It's a peptide, a short chain of amino acids, and it's been studied for its role in tissue repair, specifically in the gut. What BPC 157 appears to do is accelerate the healing of the gut lining directly. It supports the growth of new blood vessels in damaged tissue. It reduces local inflammation at the gut wall level, and it works through pathways that are separate from diet, separate from probiotics, separate from supplement stack most people are already on. I want to be clear about what this is and what it isn't. BPC 157 is still in research status. It's not FDA approved as a treatment, but the research profile thus far is low risk. And what I see clinically in patients who are a good candidate for it is positive. Women who've done everything on the diet side and plateaued. Women whose gut lining has been chronically compromised. Women whose inflammation markers improve, but whose symptoms don't fully resolve. Those are the patients where BPC 157 becomes part of the conversation. It comes in oral and injectable forms. We use both depending on the patient, and we use it as a part of a broader plan, not as a standalone fix. Nothing about this in gut healing is a standalone fix. The reason I bring it up here is because it represents something the conventional gut health conversation is almost entirely missing. The fact that the lining itself can be targeted for repair and that there's a clinical tool specifically aimed at closing the gap that diet alone cannot close. Most people researching gut health never hear about it because the world they're researching in is organized around food, supplements, and probiotics. Those help, but they don't address structural lining damage. BPC 157 does. There's a difference between reducing what's hurting your gut and actually healing it. Most gut protocols only do one of those things. What to do with this information if you've done the diet, you've tried the probiotics, you've cut the things you were supposed to cut, and you're still symptomatic. Have you ever had anyone look at what might be damaging your gut lining beyond food? That means looking at inflammation markers and at hormones, specifically estrogen, if you're in your 40s or beyond. And it means having an honest conversation about your cortisol load, your medication history, and what a practitioner who specializes in this layer of gut health would actually find if they looked. The women in my practice who finally got their gut under control weren't the ones who found a stricter diet. They were the ones who finally got someone to look at the right level of the problem. If you've tried all the things, the question worth asking now is whether the problem you've been working on is actually the problem that needs solving. The answer to your gut symptoms might not be another food to remove. It might be the conversation you've never had with a provider who knows where to look. If what I described today sounds familiar, if you've done the work and it's only gotten you part way, I want you to go watch my video on why eating less isn't working for women over 40. Because what we covered in that video is what we covered here are two sides of the same picture. Your body is not being stubborn. It is telling you something specific. That video is on your screen right now and linked in the description. I'll see you there.